So hello everyone, my name is Wendy Weaver. I'm an application specialist with NextGen, and for the next 45 minutes or so I'm going to do a detailed workflow of our NextGen Patient Portal. I'm going to walk you through how a patient enrolls in the system. I'm going to walk you through the different aspects of what the patient can do within the patient portal, and then we'll walk over into and look into the EHR and the practice management solution and look at the integration of how the patient and the practice can communicate. I'm going to start out first just by explaining how a patient gets enrolled into the portal. We do support the ability to have automatic enrollment, and that happens once a patient has some very basic demographic fields entered into the practice management solution. And those required fields are last name, first name, date of birth, birth sex, zip code, and email address. Once all of those fields are entered into the system, the patient will get an automated email sent to them saying, "Welcome to our practice, please create your portal account." And that invite will look just like this. It says, "Hello Ruth, please join our portal. Create a password." It's a very simple enrollment process. The patient has to really only hit 2 screens to be able to get this done. So let's go ahead and get Mrs. Butler signed up for her portal. So she has to put in her zip code, and then she has to put in her date of birth, just to make sure that she is who she says she is. And then she hits continue, and it brings her into the field to start putting in her information. And we're going to make it quick and simple here. And she normally works or normally is seen in the main office, so she can pick her location. We do support multiple locations, multiple practices. Not multiple locations, multiple practices. So if you are an organization that is multi-specialty, you have several practices, you can have individual one login, but can get to individual practices from that one login. The patient has to answer one quick security question. They can enter their phone number, and when they click Enter Portal, then their portal account is going to be created. And it will bring them into the window to start interacting with the practice. Now, the first time they log in, it's going to ask them, "Hey, do you want to receive your statements electronically and paper or just electronic?" She prefers to receive everything electronic, and she's brought into the portal. And you'll see from the very beginning, she understands that she needs to complete her registration form. So now we're going to go in and look at her health form, and I went ahead and pre-populated some data so you wouldn't have to see me enter all the information. But we're brought into this window here to look at her general registration and health history form. So I'm going to click into that. And I had pre-populated some of the information, so it kind of brought me back to where I was. But I'll go ahead and hit save and continue here. And before I submit it, I'll just walk you kind of through how the form looks and feels. So we'll start here with some basic information. This is a very comprehensive form. It does cover demographic information, payer information, as well as information on your health history and your medications, your problems, your allergies. So as I scroll through here, it brings me into the window. Patient can enter their address information, all of their other demographic fields, and they just simply hit save and continue, and they continue going through this window. Now, I'm not going to sit here and enter data. You don't need to see me type in data, but I just want to review the fields that the patient would see. So if we scroll back up here to the top, I'm sorry, I scrolled a little too fast there. If we scroll back up here to the top, you can see I can put in my insurance information, I can put in my guarantor information, and if we hit save and continue, obviously it will bring me to that secondary insurance with the same type of information. The patient does not have to fill out anything. None of these fields are required. We don't want to make that required for the patient, so they can skip through something if they don't know it. They can always go back to the previous screen, and they can save and finish this at another time. When they do that, it will actually bring them back to the window where they left off. So if they forgot where they were and they didn't remember what part of the form they had not filled out, the system will take them right back to that, which I think is a really nice workflow for patients. They can put in their referring provider information if they have specialists that they see. Maybe they have a cardiologist and an ophthalmologist and whomever they see across all of their doctor cares, their care managers and care visitors, whoever takes care of them, they can very quickly and easy put that information in here. She went ahead and put in some medications that she's currently taking so we can see those. Now, I will just say that all of the information entered here in this form is what we consider discrete data that is mapped to the templates within NextGen. So once somebody at the practice reviews the data that the patient has entered, then it will update, perhaps in this situation that we're looking at right here, it would update her med profile, it would update her allergies, it would update her problem list when she tells you all the problems, her allergies, all that information, as well as the demographic information. Now, if the patient wants to enter another medication that she perhaps might be taking, let's just say she says, I'm taking some Tylenol occasionally for some back pain or whatever she has going on, it just brings up a data dictionary. So, like if I were to just wanted to re-add that lisinopril, which we won't add it, but just to show you, it just brings up all the different dosage of lisinopril, which I think is a very nice workflow there. So, if I want to type in the metformin again, so that's going to come up as well for the patient to be able to see. So very quick and easy way for patient to enter medications here. Patients sometimes are not good spellers, and so we want to give them the ability to put this information in very easily and quickly. So as I move on through this, here's where I can come in and I can see drug allergies, food allergies, and environmental. We've also given the patient what we consider here a quick pick menu of allergies, kind of most common allergies we see across the spectrum of patients. And so here are those different allergies. If there's an allergy that they have, it's not in this list that we see, they can always just type it in here at the bottom. And that's a data dictionary behind the scenes, the same as it is for medications. And then we've also got our vaccine information, tetanuses, flu vaccines, pneumonia vaccines, all the vaccines here. And then if we were to come in here, top of everybody's mind today, if you had your COVID vaccine, and that information is available as well. So as we continue on through here, any previous surgeries the patient has had. So let's just say this patient had an ACL repair of their knee. So if I type in ACL, it's going to bring up those choices. And if the patient had been in the hospital for diabetes, that information is going to come through here as well. They'll just pick that and put their information in, save and continue. And then this window is just a nice window for us to be able to track health maintenance on patients. It is male and female specific, so this is a female patient. So all the things, have you had your eye exam? Have you had your dental exam? Have you had your diabetes tested? Have you had your updated colonoscopy, your mammogram, all those things? If this information is not relevant to your practice, so I'll just use a quick example here. If you're an ophthalmology practice and it's not relevant, you don't need to know all this information, you can remove these fields and not require the patient to enter it. That's totally up to you. So you do have the ability to take some of these fields out and make the form smaller if you just need less information on the patient. So we'll continue on here. Here's the patient's giving us their past medical history. What problems have you had in the past? She went ahead and clicked off a couple of things that she's had. Again, another simple, quick pick menu, if you will, of common diseases that we see in patients. But again, if there's something that they have that's not in this list, obviously this is not an all-inclusive list. They can type it in here at the bottom, whatever type of diagnosis or problem that they currently have. And then this screen here is a pretty detailed screen, if you will, on the patient's, their family history, mother, father, sister, brother. It's got maternal, paternal, grandparents, and if the patient does not know their history, they can simply click here and not be required to enter that. And again, if you are a practice where this type of information is not relevant to what you do, you can remove this and the patient would never see it. And that would be done through the implementation process. So we'll go ahead and save and continue. It brings me to this final window where we just look at the patient's social history. And she's already filled some of that information, so we'll save and continue. So if the patient's ready, she can go ahead and submit that form. And it's going to send that form over to the chart in the format of a PDF. The patient can also see that PDF. And then it was going to go into a work queue for someone at the practice to be able to see that information and accept it into the chart. When that form gets sent to the practice, it does go over into the work queue to be reviewed, and it goes over in 3 separate forms, because if you think about workflow at the practice, you've got the front office practice staff that are worried about and want to capture demographic information. You've got the billers in the back that want to make sure the payers are correct, and then you've got the medical assistants, nurses in the back that want to look at the past medical history. So each individual skill set of the practice can manage that data and pull it into the chart individually for their specific workflows. We also support the ability to be able to have the patient sign general consent forms. These would not be consent forms that are specific to a procedure or something that a patient might need to sign a consent form here. This would be for a patient, maybe a HIPAA form or a consent to treat. So I'll just show you the HIPAA form here. And this is just a generic one that we use for demo purposes. So it's going to ask who's filling this out. I'm filling it out on myself. And then you'll just see the verbiage here. Again, this is just specific to how our demo environment is set up, but you could put your own practice verbiage in here. The patient will type in their name and the date that they've signed this. And then they will just be able to initial this. And I'm going to use my mouse to do this. If they were on a tablet or a phone, they could use a stylus or their finger to do it. And again, I'm using my desktop, my laptop to show you this, but I could have done this from my phone. I could have done this from a tablet. So we do support the patient to be able to do all this information on, a mobile device as well. So I'm going to go ahead and submit that form over to the chart, and we'll go over and look at that in just a moment. So that's basically how the patient sends forms over to the chart. So let's go back to the main window for Ms. Butler and just look at some other workflows within the chart. You'll see, because she's created this portal account, we've already sent her a health record, and we've got that health form started as well. And then she's gotten some messages here. So let me explain a little bit about how messages work. So messages go over to the patient. So when the practice sends information to the portal, we send the patient an email and or a text that says, hello, this is NextGen Practice. You have new information on your portal. Please click this link to log in and see your messages. We don't tell them what the information is because we don't know if they're sharing that email account with someone else. So the patient would click on the link, use their login information, and they would come in and see their messages. And so you can see she's gotten her new health form, and she got a welcome message. Hey, thank you for joining the portal type of information. Now, if Miss Butler wants to communicate back to me from the portal, we have this ask a question option right here. So she clicks on that, and she would click the category of what kind of message that she wants to send. And these are configurable, totally configurable by the organization, by the practice, based on how you want to use your portal. So I've got an ask a nurse, I've got a billing question, a scheduling question, maybe somebody has a question about their medicines. You can see I've got a counselor and a therapist. And again, you can have these set up as in many categories as you want. You can add more, you can take these away and create your own. And the nice thing about these messages is they are routed to the appropriate person or persons within your practice based on what kind of question it is. So most practices will do ask a nurse. They route them to the MA or a nursing group. Billing questions go to a billing group. Scheduling questions, a scheduling group, so on and so forth. So I'm just going to ask a question here of Mrs. Butler. And she says she has a rash on her hand. And I see Dr. Barclay, and I'm just going to say, what should I do? about my rash. And she's going to attach an image of that rash. So she's going to come here. She's got a picture. She could have a picture on her phone. She may have something on her laptop, whatever. She's taking that image, and that rash image is going to be sent over. She could send anything, any type of document. Doesn't have to be an image. She could send a PDF documents, anything that she wants the practice to have access to or know about. So we'll hit continue. We'll submit that question, and we'll go over and look at that information in the portal, in the EHR in just a moment. So we've done the messages. We've done the ask a question. So let's talk about medication refills. So we can come in here and we can request a medication refill. She's from the main office. She uses Dr. Barclay. She'll need to add a pharmacy, and maybe she uses Uptown Pharmacy here. Let's see if that's in my list. It may not be, so let's choose one that is here in the list. Let's see, let's add a pharmacy. So Miss Butler's going to pick a pharmacy. She uses Uptown Drugs here. She'll save and continue. She'll hit the continue. She could add multiple pharmacies here if she, goes out of town for a part of the year. Maybe she goes to the south in the winter or whatever. So she could add an additional pharmacy here and pick whichever one she wants, but she's just going to continue. She doesn't have any medications on file yet. We haven't updated her medication list, but if she did, she would choose a medication and send and hit select and send that medication over to be refilled. So very quick and easy process here, nothing really hard for the patient to have to do. So that was how she would do her medications. We do also support for the patient to have the ability to pay their bill through the portal. We would do that through what we call NextGen Pay, powered by Instamed. So here on this pay bills, Miss Butler sees that she does have a balance, so that balance has come over here. She can click here into pay her bills. She can see that payment, and if we had sent her a statement, she would see her statement here. She can add a credit card on file and put in her information here. We will store that card, and she would select that card, put in her security code, and send her payment. And we have the ability to store multiple cards because, some patients will pay their portal account through a health savings account or a flexible spending account. And then if they exhaust those funds, then they might use their personal credit card. So they could have multiple cards here. And then they would just hit continue and pay that bill. And then once that payment is sent over to the practice, then NextGen will create a portal batch. And once that batch is balanced and posted to the account, then we will send the patient an updated balance of what they owe. If they only paid $20 on this $48, then they would get an updated balance back to their account. But if they pay it off, then their balance would go away, and this red icon here on the landing page would go away because they didn't have a balance. So that's how the balance would look. And then we also have the ability to send the patient their health form. So information about their chart. So let's go ahead and view this. So it's got her address information, her allergies, her meds, her problems, her procedure list. If she'd had any procedures done. So this is a CCD document, continuity of care document. So this information, once the chart is complete and the encounter is signed off, results are signed off, we send that information automatically to the chart. So it sends automatically upon an encounter being logged. Results will send when they are signed off, either from the orders module or from the PAQ. The patient can scroll to the very bottom here and actually request a copy of their chart. So if they want an updated CCD, they can request it from and to date or a complete record. The practice can manually send a CCD to a patient through the medical utility summary, or the patient will not. What also happens is when the patient enrolls in the portal for the first time, we will send them a consolidated CCD. So You're a current user of the NextGen Portal, the current portal, NextMD, and you enroll patients into the portal. They're not new to the practice, so they have historical data. We will send them a consolidated CCD as well. So if we go back to our home page, just let me make sure I've covered everything here. We do support patient education within the portal through Care Nexus. Then the last thing I'll cover here is how a patient would schedule their own appointment. This is through patient self-scheduling. So the patient can click here. It recognizes that this is Mrs. Butler, and it will bring them into creating an appointment. They can start by creating an appointment by picking their provider, picking their location, or picking their appointment type. These are all configurable options by the practice. This is real-time integration with the practice management appointment book. So when a patient does book an appointment in real time, it will hit your appointment book. Now let me explain too that there are rules that you already have set up today in practice management. Things that you use for practice management today, event types, who's tied to those events, what providers, the length of those events, what locations they're tied to. This patient self-scheduling tool is going to honor all of those appointment types, and then also has a layer of rules that sits on top of your practice management rules. So you're not going to totally open up your appointment book to every patient to be able to see anything and everything. You can be very prescriptive as to what event types you want to allow to be self-scheduled, how many a day, do you want them back to back, what providers you want to use for self-scheduling, what locations, and what appointment types. So we'll start by provider here. So it's going to give me a list of the providers. She prefers to see Dr. Barclay. So she's going to click here on Dr. Barclay's. She just needs a regular office visit. Again, you can be very prescriptive as to what kind of office visits you allow. And then she can pick what location she wants. She wants to go to the main office. She wants to see him on Friday the 27th. He's got one slot left. He's a pretty busy guy. She could move out into June if she needed to, but she'll take that 4:45 on Friday. If you want to allow the patient to, if you want to require them, I have not turned this on in my system, but if you want to require them to update their insurance information, you can do that. But we'll skip that step for now. It's going to go ahead and book that appointment. She could put in any additional information. She says everything is correct, and it brings her to back to the starting point. And you'll see here she also has the ability to schedule and readmit. Schedule and cancel appointments if you have allowed that. Again, another way to set up routing rules within the system to where the patient can only schedule and cancel certain appointments, certain times. Maybe you put a 24, 48-hour limit on, if you're going to call me 2 hours before your appointment and not show up, I'm not going to let you do that online. I need you to call me and give me some information. So you do have some rules here to set that up as well. So that is patient self-scheduling. We've looked at messages, scheduling an appointment, asking a question, prescription renewals, paying your bills, looking at your health form, and looking at creating your health forms and your health record. So the next thing we're going to do is go over into the EHR and the practice management solution and just look at some workflow from that side as well. All right, so the next thing I want to do, we're back over into the EHR. Actually, we're into practice management first. I just wanted to update you and show you very quickly, because Miss Butler did create her portal account. We can see that she has done that. We've got the green check mark. The yellow exclamation point is no longer there. So that shows up in practice management. It shows up in several other places. If I were to look at the appointment book and right click, if she had an appointment upcoming, I could right click on the appointment book and see that. And then I can see it from the EHR as well. So if I go over here to the EHR and I hover over this, let me refresh this window real quickly. It should update her. Let me close out. Let me open her back, close her and open her back up. I think I already had her opened. And so you can see where the portal account has been established. So it has been established here. I just had to start over on that. I had her window already open. But what I also wanted to show you here is when I do hover over that portal message here, it lets me know the last time she has logged into the portal as well. So let's first go to the inbox and let's look at the portal messages. So if you're currently using NextMD, our current portal for NextGen, your workflow is really not going to change that much, but we do have this portal tab here. So this is allowing me to see all of those portal messages. Here's that message Miss Butler sent just a moment ago about that rash on her hand. So I can double click on that message, open it up. I'm going to accept it. And if I want to reply, I can come here to reply to it. I also can see that attachment. So there's the rash on her hand. I can right click on that rash. I can add it to the chart. You will be able to build categories. I believe I have a PXP category in here. For portal attachments, you can create whatever type of attachments you want in document management. I'm going to add it to her encounter for today, and I'm going to say OK. And then if I want to go back, reply to that message, I can just come in here and type my notes and send those back over to Mrs. Butler. So this would be my communication back to her. I can send and chart that, so I do that very quickly. It's going to send a copy of that portal message over to her chart, as well as send her the message back into the system as well. Also from here, we separate prescription renewals in a separate tab, just because we don't want prescription and renewals to get caught up in the regular traffic of messages coming in and out. And if you're going to use appointment request and not patient self-scheduling, requested appointments would come into this inbox here also. If I'm on my appointment listing, I would see, the patient, or here I don't think I have any appointments today, but I also, from this window here on the inbox, I can see if the patient has a portal account. If I want to compose a new message, I simply click on compose. I've got Miss Butler in focus, so it's going to bring her in focus here, but I could add a different patient if I needed to. I can mask the name of the person sending this message out if I want it to come from the NextGen medical staff. I can type my notes in here, and we also support the ability for you to use kind of standard message responses. So if I wanted to use this one here about, hey, your results were normal, continue your diet, I could do that. Or I've got a standard response here for prescription renewals as well. So some quick and easy ways to help you, again, navigate that portal. That's kind of all one message there. Let me erase that. But that's how you would respond to your messages. And then I also wanted to show you very quickly how you can also send additional documents to the patient. So from here, if I wanted to send the patient a copy of maybe their plan or maybe their master document, I can just right click on that document. I can send it to portal. I can put a message in here if I want to, or just send it directly that way. It's going to go over. If she had patient education documents that you had given her that were a part of the chart, you could right click and send those. But that's how documents are sent. And then I also will show you here's that HIPAA form that she filled out. I came in here as Mrs. Butler. You'll see if I go to the next page where my signature landed on that document as well. And then also that general registration and health history form has made its way over also. Now, we also support a third-party tool for additional forms that you can use within NextGen, and that's what we would call IMH. So if I wanted to come here to Portal and send the patient an interactive medical history form using IMH, I could do that. So I'll just send her over. Maybe she's coming in for a yearly checkup and I want her to get a PAQ form, so I can send that over to her. And then additionally, from this Portal tab here, I can send any other type of document that exists on her chart. So I could send her an ABSCO document or anything else that I want to send her over also. So that is how we communicate and send information. I'll flip back over to the portal real quickly and see if those messages that I sent her have reappeared. So let's go back to her portal account. They have not made it over here yet. Let me sign out and sign back in and see if there's a message here. So if I click here, there's the PHQ-9, and there is also that master document that I sent her. Now, if the patient does want to does choose to fill out that PHQ-9 form, and this could be any type of form that we would route over into the NextGen template. So these forms are mapped directly into the standard NextGen template. So if I hit here, I can, launch out to the IMH site. So I'm going to put my name in and my date of birth. Let's make sure I got that correct. And we'll go ahead and send that over. It recognizes her. And then she's going to start filling out that PHQ-9 form very quickly and easily. The nice part about this is going to map to that PHQ-9 in the screening tools or any other template. If you would send her a form, a Medicare wellness form, or maybe she's coming in, she has a backache and you send her a form about that, or I have a cough, I have a fever, whatever type of form you want to use. And she's going to continue through this. And then when she's completed, this will go over into a queue. And when the patient checks in for their visit, the system will say, I can see you have new information on your portal. And that information, I see that you have sent us new information, and it will then send the PHQ-9 directly into the chart. We don't send that data to the chart until the patient arrives, because that PHQ-9 data is very specific to a certain encounter. So it's encounter-based information, and so when the patient checks in, we would see that on the encounter. So that is how the patient receives messages and sends messages back. Now, we'll point out here, we do have some account level settings. If Mrs. Butler were a guarantor or a guardian of a child, or even she was an adult child of an adult parent, she could have access to another account if she needed to. The patient can invite trusted representatives. I can do that here by putting in last name, first name, and email address. And then the invitation can be sent. And then you can manage, the patient can manage what they want that trusted representative to have access. As a guardian, obviously they would have access to everything. We do support age out rules. We support the state and local rules, but if you have specific practice rules, like if your age out rule was 15 and I turned 15, then my parents would be removed and not have access. But if you wanted to allow the parent to still perhaps maybe make appointments and maybe pay their bills or do other things, they could do that, but they may not have access to their full health record. So again, some different options there on the account setup. And then also the last thing I'll point out here is that we do support 4 languages, English, Spanish, and 2 dialects of Chinese. So once I come home here, that is basically the workflow for Portal. I'll encourage you to reach out to your account team if you have additional questions. We'd be happy to do a deeper level of demonstrations should you need that. So I thank you for this time and have a great day.